Good evening. Tonight I'm going to talk about bipolar depression and our research which aimed at detecting it. You see, this is a part of series that I'm planning to record and gives you a kind of overview what is going on in computational psychiatry, especially when we use electrophysiological data for detection and forecasting. So the problem with bipolar depression is that persons who are suffering from that disease are basically, in average, treated wrongly as unipolar depression. Once they got mania, their treatment is finally properly addressed because someone who is working with those people actually cannot be sure that they have bipolar depression unless they demonstrated manic episode. So sometimes, as current psychiatric method, which is standardized, works, it is impossible to realize what is going on. So as engineers and people who are working in machine learning realm and analysis of electrophysiological signals, we tried to figure out whether it is possible to help clinicians to find out about that earlier. Another very important thing is that in bipolar depressive disorder, there is very high risk of suicide. It is published a couple of years ago that actually the risk of suicide in bipolarly depressive people is 20 times higher than in healthy controls. Another caveat is that bipolar depression is very, complex disease, meaning that contrary to unipolar depression, which has actually only two phases, one phase is episode, exacerbation, and another one is remission, when person feels better. In bipolar depression, you have actually 5 different phases. And my colleagues and I recently published that research. It is Lemoka et al. 2021. And we basically laid out mathematical model how the dynamic of disease can be represented by network flow analysis, showing that actually every single person has unique dynamics, because there is already known for quite a long time that bipolar depression is cyclic and it repeats certain patterns over the time. So what we did is that we performed research where we actually worked with outpatients who are treated for bipolar depression, and they reported online, they reported actually via mobile phone application every single day about 12 different items, how they feel, whether they are irritated, what was the quality of their sleep, etc., etc. Then they were wearing wearable devices, which are actually having actigraph in it, so we can figure out about their movement and their sleep. And also they went regularly to see their therapist, who actually performed standardized interview and made his own diagnosis. So we integrated all the data for every person for 2 months, and we actually performed very complicated, very complex, should I say, pipeline for analyzing those data, meaning that we actually cleaned the data, we integrated them, we actually included both subjective diagnosis, because patient would rate how he feels in which phase he is, and then on top of that was the diagnosis which is done by psychiatrists, meaning business as usual in current psychiatric practice. And then after several methods of feature extraction, we performed different machine learning models. The aim of this research was to actually see, of all those variables, what was the most significant ones, who can basically help us to predict or warn on time to to actually early detect the signs of mania which is coming, in order to inform in time the therapist and the family who can help patients to navigate through the crisis. So after all that analysis, we actually showed that the dynamic of disease is so personal that you basically need something which is defined as personalized medicine. You need to train the model again for every single person, because it turns out to be that patients who are recording during that time, when you analyze their data, they have so different dynamics that this is so irregular and this is so different within the group that you cannot actually automatize that kind of process. So one thing that we actually got from that research is that the major two variables which showed prediction potential were irritability, the level of irritability that patients sense, and it can report about that, and also the quality of sleep, the duration of the sleep for one night, which also can be measured. So to cut things short, despite the complexity of the problem and the complexity of the pipeline that we actually applied, we still can figure out that those two variables are most important, and we are working forward to apply new models so our prediction would be better with time. There are some other colleagues who try to tackle the same problems. For example, Milena and colleagues did similar research in 2012. There are patients who were wearing ECG monitoring device, which is implanted in T-shirt during the all-night sleep. So they actually performed some nonlinear analysis of the data, and they performed machine learning, showing that it is possible to classify between healthy controls and bipolar depression. Also, there are two other papers, Nardini et al. From 2016 and Boone et al. From 2019, who actually showed that certain prediction is possible. Personally, I was puzzled with the situation, and I digged a little bit deeper, and I found out that in 2006 and 2005, there were some successful trials to predict mania based on self-report with application of entropy measures. But I will talk about that in detail in next video. So stay tuned. I'm going to elucidate different parts of the new discipline, which is called computational psychiatry. Thank you for tonight. Bye.